Hey, PatriotRN with another video response on sterile dressing. Um, I I don't in the kind of environment that we would work in, so either at home or outside or even in the ditch. Thinking about sterile procedure is almost unthinkable. The only really sterile place that I know of is in the operation room. So unless you have a room that is really decontaminated and everything, sterile dressing is at best you can have clean dressing, which probably the best thing to do. If you clean it pretty well, even if your dressing is clean, but your wound is still kind of dirty, the dressing that you're going to pull on it is even if it's sterile, then it won't stay sterile very long. Um, Burn management on the long term would probably be beneficial, but then again, having sterile glove and sterile dressings and sterile thing is very time consuming. Not only that, knowledge consuming, because the person needs to know how to do a proper sterile procedure. And not only that, as well, is that once those supplies have been used, now we need a way of like either getting more of those supplies and then supply limited situation that it can be very costly, or be able to re-sterilize those. I know there's some website talking about using heat or vapor to sterilize instruments and some dressing, things like that. But I believe it would be much more thinkable of doing a clean procedure than a sterile procedure. And one book, if I could recommend, is more pharmacology nursing would be a good one, but as well as um, basic nursing procedures, how to make change a bed, how to change and turn somebody, and things like that. Especially if we're talking about doing those kind of dressing in burn patient or something that will need a lot of cares. And those books can be bought a lot of time by at nursing schools or college for price, because students after they finish either the first semester or second semester a lot of time get rid of. So I would recommend that book, and I'll put the link down. But sterile dressing, I usually carry mine clean, and they're easier to be protected as well, so I take them off of the piece of paper because they don't need to be sterile, but I prefer to put them in those little plastic bag or even kind of Ziploc bags, so they kept them better protected from the environment, but as well as now they can be kept clean. So if I can keep a clean technique more than a sterile technique, then it's I think much more appropriate.